Bismillahir Rahmanir Rahim. Wassalatu wassalam ala Rasulullah. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Aisha Khan, and on behalf of the Muslim Unity Center's Education Committee, I welcome you all to our mental wellness series. InshaAllah, going forward, we will be bringing mental wellness programs in a regular cadence. Our goal is to provide meaningful mental wellness programs by mental health professionals from our local communities across the nation and perhaps across the world, so that the families in our communities can benefit. So tonight's speaker is Dr. Saba Maroof, and she'll be talking about COVID fatigue and how to manage our mental wellness. I'm sure many of you must have been feeling the COVID or pandemic fatigue for the last few months. Well, I am actually feeling that myself. So Dr. Maroof is here to help us with tips on how to feel motivated and get out of complacency, inshallah. So after Dr. Maroof's presentation, we will have some Q&A time. So please feel free to send your questions in the comment section of Facebook, YouTube, whatever platform you're using. I will be monitoring those questions, inshallah, so I'll be able to ask them with Dr. Maroof. So it is my honor to introduce our speaker, so I'm gonna bring her to our live stream here. Hey, Saba, assalamu alaikum, how are you?
Walaikum assalam.
All right, okay.
Thank you so much for having me.
Yeah, absolutely, absolutely. So excited and looking forward to your presentation tonight, inshallah. So I'm gonna, I know many of you know Dr. Saba, who's right, from our community. And she actually has been with a guest speaker at the Muslim Unity Center many times. So, and she is loved by our community and many communities. So now with actually with the live stream, this program is being broadcasted, and alhamdulillah, many people across the community, across the nation will be benefited. For those of you who don't know or would like to know a little bit more about Dr. Maroof, I'd like to just read her bio. So Dr. Maroof, Saba Maroof is a board certified child, adolescent, and adult psychiatrist. She's originally from North Carolina and moved to Michigan after getting married. She completed a master's in medical sciences and attended Wayne State University School of Medicine. As the daughter of a psychiatrist, her mom is a psychiatrist, she decided to specialize in the field and did her residency at Henry Ford Hospital. Followed by a 2-year fellowship in child and adolescent psychiatry at Wayne State and Children's Hospital, she has been working in various outpatient settings in the Metro Detroit area and has been seeing patients for more than 10 years now. She enjoys mentoring students or medical students, and also gives lectures to med students, residents on topics such as depression, eating disorders, bullying in ethnic minorities, addressing the stigma in our communities, and special topics specific to Muslim communities. She enjoys being involved in community education and spent some years helping organize seminars and talks at IAGD, that is Islamic Association of Greater Detroit. She lives in Troy with her husband, Dr. Fasahat Hamzavi, and their 4 children, ages 14, 11, 8, and 5. So Dr. Maroof is a very busy mom, but she's still doing all this stuff. So glad to, and it's an honor to have you here, Dr. Saba. So I guess you take it away.
Thank you so much, Sister Aisha. Jazakallah khair. Thank you so much for organizing these talks. And also just thank you to the Unity Center. Thank you to Imam Al-Masmari for, mashallah, always keeping mental health topics on the forefront. And I really commend this community for doing that, for continuously having educational talks on these types of topics, really, mashallah, throughout the years. Thank you. I saw Noshina Auntie commented that I grew up in the community. Yes, that is true. I also lived here for a few years. I didn't include that, but in Michigan in high school. So I've kind of gone back and forth between North Carolina and Michigan. Alhamdulillah. Very blessed to be part of this community. So I will share my screen in a second, but I know that Sister Aisha really wanted me to talk a little bit about just COVID, mental health. I know we've had several talks about this actually. If some of you joined us, we Lubna and I did some talks, invited some others too in Ramadan. We had some mental health talks as well. And of course, this has been something that's been on our mind for now 7 months. But it's interesting because with almost like each change of season, and as this kind of goes longer, there's different things that kind of are coming up, different aspects of dealing with this pandemic that we weren't previously dealing with. And I know Sister Aisha kind of wanted me to talk a little bit about my experiences too, and just kind of what I'm seeing. And as she mentioned, I see patients of all ages. My youngest right now probably is age 4 to in their 70s. So I really see like a wide range. And I see people that work in factories. I see special needs kids. And I mean, with all of these individuals and families, everybody is really experiencing this pandemic in different ways and unique ways, but it's definitely having an impact on everybody. I have families, that have experienced the death of several loved ones, not just one, and children that have special needs that really regressed, especially during the immediate shutdown, the lockdown in March. And it's been really interesting. Even now, I'm seeing people that are talking about kind of what's been happening since March till now, and just now they're kind of getting into help. Things kind of went. They kind of had to. They realized now that they needed to reach out for help. And then also, as Sister Aisha mentioned, I'm a mother of 4, and a lot of times people ask me if being a child psychiatrist helps me to be a better mother. And I actually think it's the other way around. I think being a mother helps me be a better child psychiatrist because I can really relate to people's struggles, and it's. Even when I'm giving some advice or recommendations, I know like the reality of what's happening. For example, like turning off electronics and limiting screen time. It's very easy to say that, but when you're in the house, especially with your kids right now, being at home all the time, it's easy to say that. And I feel like I can sympathize and empathize with families more. Okay, so I'm just going to go ahead and share my screen. We'll talk more about these things as we go on. I mean, this is such a huge topic as well. That I'll try to, let's see, that should be working. Let me know if that's working. Okay, here we go. There we go. It's such a huge topic. It'll and again, we've been talking about this little bit more regularly over the past several months. So I'll just try to hit on some main points, but really we could talk about this all day. And this is kind of what I talk about day in and day out right now. And the interesting thing again about being a psychiatrist and seeing patients again of all ages and families of all ages, and you'll see that in some of the graphics and stuff, is that we, mental health professionals, physicians, therapists, psychiatrists, we are all experiencing the same highs and lows that people in the community are feeling, that our patients are feeling. So it's literally, we are all in this together, and that makes it a very unique experience. Okay, let's see. I'm gonna do full screen, then I will lose that screen. That's okay. Okay, 1 second. Here we go. Okay, so basically, yes, we're talking about kind of fighting COVID fatigue, really just generally talking about COVID and mental health, and just what we can do to bolster and to support our emotional wellness at this time. And these are a few things that we're going to talk about. I'm going to touch on a lot of different areas, but again, there's so much to talk about, but I'll try to keep it as organized as possible, and hopefully you will come away with a few key ideas. Basically kind of when we talk about COVID, this idea of COVID fatigue, really kind of tying it into ideas that we have about burnout. And then I'll talk a little bit about the impact on different groups: kids, students, adults, particularly women, impact on older adults, and really kind of just some themes here, which are one of the themes is really from coping to adapting. So, initially when we're talking about what was happening in March and April, everyone was just, we were all just kind of scrambling to get things ready for our family, getting the things that we needed, toilet paper. I was just thinking back to the kinds of things that were sold out for so long that you could not get. None of us were going to the stores in person, right? We were all getting things delivered. I remember when it was so hard to find even like chocolate chips, certain types of bread. The first time I went to the store, the one time I went, almost all the bread was gone. And it was really, we were kind of in this phase. We were just trying to hunker down and just kind of prepare as much as we could for our families, especially, I would say, the parents, the adults, and especially the mothers out there. There was an immense stress on us, I think, dealing with our own emotions, but also making sure that we had things ready and prepared for our kids. So that was kind of the initial phases. And now we've been in the phase of kind of more adapting. In the beginning, we weren't sure how long this was going to last. We thought, okay, maybe this is going to go on for a few weeks or a few months. I know our president thought that we would be all clear by Easter. But it's gone on, and we're going into like our 7th month, and now, especially in the fall, slowly going into the winter. I know a lot of people, it's not just that we're tired of what's going on and of all of this and this new way of life, but I think many of us are kind of anticipating how things are going to be in the winter. Winter definitely is a difficult time for many people. And so I that's kind of why we wanted to kind of address this right now as well. So these are kind of some of the themes, like I mentioned, really kind of this idea of COVID fatigue, which ties into this term that we know as burnout. And then also kind of this idea of uncertainty tolerance. I'm going to bring that up at the end. And there's a really amazing study that was just recently done by the Stanford Muslim Mental Health Lab and Yaqeen Institute, actually, that Dr. Rania Awad actually just presented on last night. And so I wanted to share a little bit of that. And just kind of some ideas. Out of crisis comes opportunity, and a very important idea of how increased stress really means that we need to all have increased support. And this is kind of a main theme. I'm sure many of you have been reading a lot of different articles. Maybe some of you have been listening to podcasts. There's a podcast that I really like. It's parenting during COVID. It's a psychologist that I really admire, and this is something that she really emphasized, and I think it's definitely true, especially as we're kind of all have been getting used to this idea of social distancing, and we realize that really this term social distancing is kind of a misnomer. I wish that many mental health professionals wish that they called it something different, like physical distancing, because socially, we are social beings. We are biologically entrained to be together, to be with people. And while we're trying to keep safe, while we're trying to keep our distance, we really need to be around each other. And I know that many people were worried when the lockdown first happened, especially in the Muslim community, as Jummah was canceled, as we thought about how Ramadan was going to be. Ramadan is such a communal, collective experience. How are we going to experience this by ourselves? We, as a species, whether you're an extrovert or an introvert, we need each other. And I think everybody has realized that we all need to make the effort to reach out and still keep those connections alive. Physical distancing does not need to be social distancing. So this is a really interesting graph. Actually, I used this graph in a few of my earlier talks that I did for Unity Center and some other places, and I thought it was very interesting. This wasn't specifically developed for COVID. It's really any kind of traumatic event, even like an earthquake, tornado, something that the whole community or society, nation is facing, right? And we definitely can use it when we're talking about COVID. And it's I don't know if you can see I think you can see my mouse, but I think it's a really, I think it's a very nice illustration on kind of like the highs and lows. Literally, this says emotional lows, this says emotional highs, and kind of tracks how we definitely, we have these emotions that kind of go collectively, almost like a roller coaster. There are times when we kind of take some dips, but there are some times when we have some emotional highs too. For example, where their impact happens, there can be this time of community cohesion when people are working together, when people are coming together. And then there can be this period of disillusionment, when really sometimes there can be some emotional lows. And it's interesting. I mean, of course, this is such a multi-layered event. It's not just, we're not just talking about health, but we're talking about mental health. We're talking about economics, the financial stress and strain of all of this, and just the collective social psychology of all of this, right? Even just seeing people when they're not really so being responsible and social distancing. You see pictures of different people having gatherings, and what kind of emotions does that evoke in you? How do you feel when you see someone in the store that's not wearing a mask? All these things can kind of sometimes lead to sometimes negative feelings. And I'm not sure, but I wonder if in this area, in this time right now, if we're kind of a little bit of some people maybe are kind of in a little bit of a low. And but that does mean with every low, everything that goes up must come down, and vice versa. At least according to this graph, it's interesting that things do start to kind of come back up. And part of that is kind of coming to terms with what's happened and working through grief. Now, this is, when you have like one actual event. That's why they're talking about the anniversary reactions, which is interesting. And if anybody has experienced the loss of a loved one, we know the anniversaries are really important milestones, and they can really evoke a lot of emotions. This is another chart that I really like. And again, it kind of shows really the long-term impact of mental health. Now, we do have, of course, like the first wave, second wave of the immediate mortality and morbidity of COVID-19, basically how people are recovering. Some people are, they might not meet their demise just from the virus, but from, from the kind of the ramifications or the sequelae, the complications afterwards. And how does this interrupt the care of chronic conditions? Many people are, maybe letting other things fall behind, like their dental care, their regular and routine screenings, mammograms, colonoscopies, things like that. Everybody's so scared to kind of even set foot in a medical building that we're kind of putting these things off. And that's actually really important to address. Actually, I have some really good friends of mine, physicians, female physicians from across the country that are working that are on the front lines. And I know one of them who's actually an infectious disease doc, one of my really good friends, she said, if you want to, don't put off your dental care and those kind of screenings, important things, if the time is to do it right now. So if anybody needs to hear that, it's really important to go ahead and take care of those things if you can, if you're not too immunocompromised, things like that. But the important things about this graph is this red line here, right? This is like kind of like the fourth wave, and this is like the financial crisis, but the burnout that we're going to be talking about, and how that all ties into the mental strain. And for some people, it can come out as, a mental illness or psychopathology, the psychic trauma, if you will. And this one, maybe we weren't really focused so much on that right away. We were trying to take care of our, immediate, proximal, basic, essential needs. But, mental health, you can't have health without mental health. And as you can see, as we are kind of coming out and moving on and facing this strain, just kind of increases and exponentially. Now, I really like this cartoon, and it really describes a lot of the people that I see very well, and just kind of how all of us are feeling. We all kind of have like our regular anxiety, the things that kind of make life interesting, the ups and downs of life. And then we're handed another ball here to juggle, which is the COVID anxiety. And then, this time of year, it just so happens that it's correlating and coinciding with the election. And this is, a very tense election cycle. And then you've got seasonal depression, as I mentioned before. And definitely in Michigan, we definitely feel that. I mean, I can say that literally the weekend after the time change, everybody, it's just so, everybody can pinpoint that their mood, that they come in to see me, their mood changes so drastically with that time change. mean, seasonal depression is something that's very real. And then just, all the other worries that we have with global warming, with the Black Lives Matter and the social justice issues. There's so much. It's really actually amazing how much we are dealing with. And then I like this last one, just to top it all off, existential dread. Like, what is the meaning of all this? And so it's one thing, and many of the people that we see, I see them because, they're dealing with their regular, but, anxiety and depression. And we've worked on coping skills. They see their therapist regularly. They have their different coping skills and the ways that they take care of themselves figured out. And then we throw in all these other balls that we need to juggle. And it's like almost like okay, we have to reevaluate this and kind of reset here. So here's a few quotes kind of about, what are we talking about when we use this term pandemic fatigue? And this was an interesting article, actually. Aisha, I think you mentioned it to me, and I happened to read it right after. But basically, just kind of, there are many people that are kind of all ages that are a little bit tired of adhering to all of this, right? So here's some quotes from this article. Trying to adhere to anything extra is always a challenge. You can add extra steps to your routine for a few days, but sometimes that sustained behavioral change is hard, especially when no one around you is sick and you just don't feel like wearing a mask or saying no to the things that you like to do. And I thought this was especially true. I think wearing a mask, to be honest, I think that's, I think especially kids have adjusted really well. My kids, two of them are at Huda School, and we chose to send them in person because they have amazing safety measures in place, very small classrooms. And my 8-year-old daughter was really worried about, how is she going to do wearing a mask all day? But alhamdulillah, and I'm sure you've experienced this maybe with your own siblings, children, grandchildren, they really do get used to it. But I will say, saying no to things that you usually would like to do, that one's really hard. Especially, how long can you say no to your kids when your son wants to play basketball with his friends at Unity Center, when your kids want to get together? And now it's one thing when it was outside, but this is one of the worries that we have as it gets colder. How are we going to adjust to going to not being able to gather outside and being inside, where, the risk is definitely higher. Just kind of saying no all the time, and just every decision, it just takes so much energy, and weighing the risks and the benefit, the pros and the cons. So, this is why people are getting kind of tired right now. And the other thing is, this is also balanced with this. Right now, most people are still removed from the consequences of getting COVID-19. The risk might not feel real to them if they don't know anyone who's sick. And unfortunately, some people get a bit of a thrill from doing something risky and escaping consequences. And particularly, sometimes adolescents can be like that. There is a little bit of risk-taking behavior, which can take different forms. And we're we're kind of seeing that as well. And definitely, I think it really, the other thing that COVID has brought about is just exposed is kind of this magnifying glass on how stratified our community and our society is. Because as we know, basically, COVID has definitely disproportionately impacted us as a society, right? People that live in close quarters, closer to each other, bigger families, extended families, and basically lower socioeconomic class. We know that it's impacted the African-American community, Hispanic American communities in a very different way. And so if we kind of have to recognize that privilege, that maybe you don't know anybody directly that's been impacted from it. And I definitely think that this plays a part into, even the politicization of behind wearing a mask. It's really easy to say, okay, well, you're infringing on my rights if you don't know anybody close to you that's been impacted and not just had the virus, not just been inflicted with it, but hospitalized or been close to dying or has died. And this is just kind of to show you that we are all dealing with this fatigue. We're kind of all dealing with the burnout. This is actually the cover of our journal, the American Journal of Psychiatry. And I am guessing that is a psychiatrist on the cover. And the one of the articles that was circled here, the title is Wellbeing, Burnout, and Depression Among North American Psychiatrists, the State of Our Profession. So really, when I'm saying that we're all in this together, we really are all in this together. This is the cover of our illustrious journal just this month. And I think it just says a lot that, it's getting long and it's hard for everybody. So what is burnout? So I'm going to kind of basically use these definitions of burnout to kind of describe interchangeably the COVID fatigue or COVID burnout. There's actually three components. Now, burnout is something that's gained a lot of attention. This term has gained more attention, more in the professional sphere, in the last 10 years in the professional sphere. So it's definitely something I'm hearing about almost every field. For example, the medical conferences, any conference that they have like a lecture on burnout, and it's not just in psychiatry. Actually, many of there's been a surge of physician coaches that have been coming out, and they're from all different backgrounds, not just psychiatrists, anesthesiologists, neonatologists, and they're all talking about burnout, especially in the medical field. It's something that we see a very high rate of. But it's really in the past few years that we've been talking more about, there's been more of an emphasis on talking about burnout in caregivers, in parents. It's definitely not limited to professionals. But really kind of there's three components. So one is emotional exhaustion. And this is the fatigue that comes from that emotional investment, from caring too much for too long. Depersonalization, this almost kind of cynicism. You might hear people saying that they after they're feeling kind of jaded, and it's kind of like this depletion of empathy, caring, and compassion. It's just, you're so tired that it really does impact your ability to connect with other people and with that empathy. And that's why it's really important, actually, any kind of field where you're caring for other people, or just as a parent, because if you lose empathy and connection, then that's kind of a warning, right? A red flag. And then this decreased sense of accomplishment, and basically the sense of futility, feeling like nothing that you do makes any difference. So these are kind of the main components of burnout. And then when we're talking about COVID, we're talking about, chronic stress, this compassion fatigue, and even vicarious trauma. Even if you're not going through something that's traumatic, if as a caregiver, as someone that's taking care of maybe patients or other people, if you're hearing of those stories all the time, then that also can have an effect on you. So these are kind of some of the things that can kind of impact, cause, and maybe some levels of burnout. So, what do we know about how COVID has kind of impacted us and impacted different segments of society? Now, we're in October, almost in November, and there's been so many surveys. There's a lot more data that we have, actually, specifically to like how COVID is impacting people now. I know when I was preparing some talks for April and May, we were looking at a lot at previous pandemics, even like SARS in Canada. There was quite a few studies that came out of Toronto, but now, it's been a few months out and we have a lot more data. Which is good. So, for example, this was a survey that was done with this collaboration of Flex Jobs and Mental Health America, that were looking actually at burnout and the mental health status, really, of the working employed workers in the United States. So that before, this was, the blue line is kind of the employed workers with poor mental health before the pandemic. And now you can see at least in the respondents, and the employed workers with poor mental health during the pandemic, after it started. And a lot of studies I've noticed are looking at that. They're looking at, like, for example, depression rates just a year before, 2019, and then comparing it to 2020. And almost every indices, every measure, every survey, you're seeing, of course, increased levels. So here, employed workers are more than 3 times as likely to report poor mental health now versus before the pandemic. And, and particularly women, are hit in a unique, in a different way. Already, as women, mothers, wives, daughters that are taking care of their parents, aging parents, sometimes, we really carry what we call like an invisible load. And there is this idea, this term called the care economy, which kind of describes the unpaid work that women do. So here we are, in a society where we are, we're supposed to be in the most equal society in the world, some say, or at least what we strive to be. But there's still expectations of gender roles, and regardless, women definitely pay, kind of do carry the brunt and kind of that load, even if they're working outside the home. What some call the second shift. So even if women are working outside the home, they come home and they have to do everything for the kids. Many women have been, they're more likely to have had to leave their jobs as children are at home from school, number one, during the lockdown. And then now, most kids are not back in school, definitely on a regular schedule. Some schools are now doing hybrid, but what does that mean? Especially for young children, someone needs to be at home, and more often than not, it's the mothers that have to be home. I know I have a single mother that I was seeing. I just started seeing her son for different behavioral issues, and we were just starting to work on things when she decided, like, she's a single mom, and his behavioral issues were so great that she couldn't just have like somebody at home, like a tutor or a babysitter, help him with his stuff. If it comes to teaching, then she needs to be home with him. Otherwise, he really acts out. And so we had just started to get started. We had just started with treatment, trying to figure out the right medications and the therapy to kind of help him, get him acclimated and calm down and just kind of get him ready for learning. And then she had to leave her job because she had to be the one to be home. And so she had to, with that, there was a change in insurance, and they'll have to find another therapist, provider, and everything. But definitely the increased need for childcare definitely puts more of a strain on women. And again, it's definitely a different and more of a challenge for single mothers. And there is some data that more than 50% of women with children under the age of 18 have reported a negative impact to their mental health due to worry and stress. And actually, but still, it's not that it doesn't affect men, even, upwards 49, almost the same, but less, but 49% of men with children under 18 also reported this negative impact. And this is kind of a chart that shows that. This is the psychological distress during COVID-19 among those that are married or living together by gender, and whether they have school-aged kids in the household. So you can see females are the maroon line and the gray line. So basically both of these, they're measuring psychological distress, the percentage that are reporting psychological distress, and the men are down here, the orange and light orange lines. And the highest here is women with kids that are school age in the household. But interestingly, definitely women with no kids are up here too. And they do have higher rates of, they're reporting higher rates of psychological distress than men too. So women definitely kind of do carry extra burden. And added to that, there's definitely studies that are showing that minority women of color and minority women even, add to that too. They have even more of a, they're reporting even more higher rates of psychological distress. Now, how about students? Adolescents and students, already rates of mental health issues were kind of already on the rise with adolescents. And for example, even when we look at statistics with suicide, I did a talk on suicide for actually my community in Raleigh. That's a nice thing about COVID is you can do all these talks online. And suicide is actually the 10th leading cause of death in the American population. But when you're looking at teenagers, young adults, I think it's ages 14 to 24. It's a second leading cause of death. And those rates have been rising in the past several years. So already those rates were rising. But specifically now, because of the pandemic, for example, the CDC did a survey, and they found that over 40% of their respondents reported an increase in mental health symptoms as a result of the pandemic. A quarter of 18 to 24-year-olds reported serious thoughts of suicide in the past 30 days. And in another poll, 83% of teens with they already had a history of mental illness. 83% of those teens said that the pandemic was directly making their condition worse. And why? Of course, isolation is huge. Losing all those things that kind of ground kids that kids look forward to. And I'll talk a little bit about that. But the lack of resources, there's lots of resources that kids get in school. And I think schools are doing an amazing job, especially now coming in from the fall. In the spring, it was very hard, of course, for everybody, teachers, kids, parents. Everything was just so sudden. Now we kind of had a little bit of time to prepare. But still, there is, the distance, it does make it still harder, a little bit of a barrier to access some of those resources, especially when you're talking about special ed students and the needs that they have. And then just the peer support. And that's something I wanted to mention too, as parents, we have expectations of our kids to do well in school, but just realize what they're missing. I know many parents are like, okay, well, they're at home, they should do well, they have no distractions, which is true. But also, keep in mind how hard it is for kids not to be in that school environment, and how much they look forward to being, as much as they don't want to admit it. But looking forward to seeing their friends, the little things during their day that they look forward to, and they don't have that. So that, all these things kind of might be playing a part into this. And then we talk about older adults, and this is definitely a special population too. Already they're at higher risk of a serious illness. And there is a special toll that this can take on their mental health too. We know there's increased rates of depression and anxiety in all adults, but for 1 in 4 older adults did actually, in a survey, that there's some really good surveys that the Kaiser Family Foundation has done. They've done serial, at different points in time. And they have some very good data on their website, but they have also found and reported that 1 in 4 of older adults that's aged, I believe, 65 and up reported higher rates of depression and anxiety during this time. And speaking of, this is actually a chart from their website, the Kaiser Family Foundation. A quarter of older adults reported anxiety or depression amidst the pandemic, and some groups reported higher rates. So particularly those that live alone, women, again, Hispanic Americans, definitely there's a correlation with the income, lower income, and let's see, and relatively poor health have higher rates. Okay. So I'm going to move along because I have a little information and I don't want to take up too much time, but I kind of mentioned kind of the consequences of the school closings. So just interruptions in learning, the confusion and distress for teachers. This is kind of more in the spring. And I think as a parent myself, things are generally for many people are better. I think a lot of, we're just kind of all trying to figure it out. I talked to a lot of administrators and principals even, and teachers. And, I know so many of them were working all throughout the summer. So I think we're kind of in a different place here now in the fall. But still, just even doing the remote learning is definitely a challenge for many children. And there are some subpopulations of children that are at higher risk, lower income children. We don't, at the same time, again, this is putting a magnifying glass on a society and all the inequities that we do have. Of course, if you don't have high speed data and Wi-Fi, if you don't have, you need like an iPad or a computer for every child in the house. That's simply not affordable. If the district cannot provide it, then what happens? I'm sure some of you have seen the pictures of some kids that are sitting outside subways or outside restaurants trying to get their Wi-Fi. Definitely racial and ethnic minorities are going to be at higher risk at times if we're talking about kids that are in more rural settings. English is a second language, English language learners. I mean, how do you do, how do you provide so many other services, virtually? Any children with disabilities, there's so many services that kids get in the school setting, such as speech and language services, and it's so much harder to deliver remotely. And then children, in different types of different transitional points. This is just kind of a graph. Younger children are at greater risk as high levels of stress and isolation can affect their brain development and sometimes have some long-term consequences. Particularly if we're looking at parents, there was a survey of parents with disabilities, and these parents really had higher rates of depression and anxiety. These parents are now responsible for educating and supporting their special needs kids. And again, COVID again highlights these inequities and disparities. Now, this was a talk that was a webinar that was put out by the American Academy of Child and Adolescent Psychiatry, which is a great website. They have a lot of resources on there, acap.org. And I thought this was kind of a nice thing. So the idea that out of crisis comes opportunity. And this is something that I've kind of seen as a parent myself. I have a new a high schooler, and he's in 9th grade and, starting high school as a remote student, all online. And it's funny, he's actually really kind of really doing well. I mean, he's enjoying it. So that, and this is not a generalization. Every child is different. Every situation is different. And this probably speaks to, the privilege that we have too, but not all distance learning is bad. Some research suggests that some students can retain 25 to 60% more material when learning online compared to only 8 to 10% in the classroom. However, at the same time, I think that, that could be our district and the way that they organized it. I think being on, in front of Zoom in a computer for long periods of time is really hard. And that actually, talk about fatigue, that definitely can cause fatigue. So that's definitely a challenge, and not all children, learn best this way. But I will say the teachers are doing an amazing job, just kind of listening into, like, even personally, my son's class, they're doing breakout sessions and they're trying to do things as interactive as possible. They're doing an amazing job. E-learning requires 40 to 60% less time to learn than a traditional classroom because students can learn at their own pace, which could be true. Some students have felt empowered by this during a time of very little control otherwise. And new technology can offer creative engagement tools, chat groups, video meetings, document sharing, voting, Kahoot, doing quizzes online that can enhance learning. And so these are kind of some things that have come up. But at the same time, definitely there's kids that do have a harder time. Kids have to be more motivated. Parents have to check in and make sure that the kids are turning in assignments, that they understand how to turn things in. They have to be motivated and independent enough, or at least take the initiative to ask questions. It's really easy to miss things and to just kind of let things go. And we definitely saw that in the spring. But so far in the fall, might be a little bit better, but it doesn't mean, we still have to kind of keep tabs on our kids. So shifts to distance learning modalities can foster increased and improved learning opportunities if it is done well with access for all, for a subset of kids. There's definitely challenges, but there's some that could be doing well. Especially, I think maybe kind of the older kids too. But if we're talking about college kids, that's another challenge. Maybe academically it's okay, but that's not really what college is about, right? It's really, the college experience is so different, even where you can study. I know when I was in college, I could not study at home. And now these college kids, they can't go to libraries, they can't go to, coffee shops or anything like that. So it's a challenge, and it's something. It doesn't mean that we have to, it basically means that we have to approach them with some understanding and just some empathy and try to put ourselves in their shoes. This is just kind of a graph showing some of the things that we're dealing with when we're talking about kids. 1 in 6 experience mental illness. Schools are where mental health concerns are most likely detected. Also, with being home all the time, there can be a lot of stress in families. If you're talking about families that were already dealing with high conflict. I have some families that already were in the midst of, some relationship issues, and I have one family that was in the middle of a divorce, and then everything happened, lockdown happened, and everybody was at home. For some relationships that helped, and for some it definitely didn't. And we definitely know that there's a risk of domestic violence and child abuse too, with being in close quarters. Sometimes school is the one place where sometimes those mental health concerns are most likely to be detected. So if we don't have that, if we're kind of disconnected, then we might lose that. Also, where some kids, it's the only place where they're getting their nutrition. If they're, part of the food programs and getting the lunches, it's the only place where they can get mental health care too for some kids. If the parents aren't, initiating that, or if they haven't figured out their insurance or found a place where they can go that takes their insurance. So I wanted to share some other information. Okay, what about particularly, what about Muslims and COVID? So this is some data, as I mentioned, that was really interesting, that was just put out by the Stanford Muslim Mental Health Lab, Dr. Rania Awad and her group, along with the Yaqeen Institute. And they basically, what they did is they sent out surveys at 3 points. It was like right after the lockdown, right before Ramadan, and actually after Ramadan. And they actually had like 9,000 respondents. It was, mashallah, like amazing. They really reached a lot of people. But what they did is I was going to look for that number. They basically use the data really only from Western countries. They looked at Muslims that live in non-Muslim majority countries. And that was roughly an N of 4,300 respondents, which is amazing. So I was just wanting to share a little bit about that, to just talk a little bit about how Muslims have been coping. Is it a little bit different? And I think it's actually kind of promising. And I include this to kind of, also remind ourselves, I know how we were feeling before Ramadan this past year, and I know how we were feeling after Ramadan. And the cool thing is that her data really actually kind of reflects that and reiterates that. So despite mosque closures, 73% of people reported having a better Ramadan this year than last year. And there was actually they had different measures, but they found that there was an increased religiosity of Muslims during the pandemic. In April of this year, 24% of Americans overall actually felt that their faith had increased since the pandemic. That was just all Americans. This was other data that just came out this year. And when we look at Muslims in particular, almost 70% of Muslims actually reported having an improved relationship with God. So I thought this was, that's definitely something promising and some good news. She also, Dr. Awad, gave a presentation last night, and they looked at this measure too. And I thought this was really interesting. I really wanted to share it with you all. This concept of uncertainty tolerance. Basically, Islam encourages us as believers to acknowledge that certainty only lies with God. And I am sure, all of us have kind of reflected on this. We're going from a time where we were certain in Amazon, right? Amazon Prime. You knew that if you ordered something, you were going to get it in 2 days. I mean, and actually right before this, it was like you could get it the same day, right? Same day delivery. And we were so reliant on these external factors, and I mean, it was just really kind of, now you're seeing that this was just a luxury, and you would never think in this day and age that all of that could be taken away. You would never think that in this day and age that you could go to the store and you wouldn't be able to find what you needed. And that's kind of what uncertainty tolerance is, tolerating that level of uncertainty. And as Muslims, this is actually really kind of at the core, right? This is it really is a strong pull to our belief, to our aqidah. Really, Allah subhanahu wa ta'ala is the only one that is in control. So even despite how religious a person is, a high degree of uncertainty intolerance increase the odds of suffering from major depression by 60%. So this is just really significant. What that means is, if somebody cannot tolerate that feeling of uncertainty, then they have just increased their odds of depression and anxiety, in this case, major depressive disorder, by 60%. Uncertainty intolerance was correlated with more negative coping behaviors and more financial worry. Again, the inability to tolerate that uncertainty is correlated to major depression, negative coping behaviors, and worry about finances. Future research on uncertainty tolerance and religiosity is essential to improving the lives of Muslims in all facets of life. And so this is just kind of a slide just talking about the initial, stage one. This was their first point of where they were giving out the surveys. At that time, this was kind of the initial phases of quarantine. 11% of the sample reported experiencing poor mental health. These are Muslims in Western countries. 11% were experiencing poor mental health, either most of the time or always. And 48% reported little to no mental health issues. So that's good. Again, uncertainty intolerance was strongly related with poor mental health. And I think that's kind of really the key takeaway there. Seeing blessings during COVID-19 was positively correlated with gratitude, praying 5 times a day, and reading Quran. Less than 1% said their relationship with Allah subhanahu wa ta'ala had gotten worse. 4% thought it was the same. 38% said it was somewhat better, and 35% said it was much better. And so really the discussion was that COVID-19 really affects how Muslims practice and access their faith. And, previous research has found this. This is something I love to talk about. I actually did my grand rounds on religion and spirituality and mental health. And I give lectures to residents and fellows, particularly on Muslim Americans. But that research across all, and then this is all across all faiths, that, religious participation, going to even any church, synagogue, mosque can be really protective in many ways. But it's found, this research, particularly for Muslims, was found that religious participation in mosque attendance was central to Muslims' recovery from mental illness and associated with lower depression rates and improved social functioning. These are studies from 2007 and 2015. In 2013, there was a study, Muslims with greater mosque attendance and congregational involvement have greater levels of support given and received from community members. And basically, it really, Harold Koenig is from Duke University, and I know he's written a lot about mental health and religion, and he's really looked at the literature, put out a lot of the literature that looks at religion as a protection against distress and mental health crisis. Now, and even Dr. Awad mentioned this. This is kind of like, this is a positive thing, positive data, but it's kind of a double-edged sword. So what that doesn't mean is that if somebody is having issues with mental health, we don't want that to mean to play into this stereotype, or basically the stigma that if you have mental health issues, it means that you have your faith is not as strong, right? Or that of course going to the mosque and being at the masjid can help your mental health, but it might not be the only place that you need to go to if you need professional help. And, I know that Mala Musmari is a huge advocate for getting help when it's needed. And, we have regular discussions with him, other Muslim mental health professionals in the community, with the imam, really kind of emphasizing this. So I want to kind of definitely make that clear too. So this was just kind of the results of the survey when they're looking at mental health after Ramadan. And they found, this was interesting, everybody was worried about fundraising and things during Ramadan. People were, this idea of philanthropy, actually many, were donating just as much. But interestingly, looking at social isolation in Ramadan, experiencing a good Ramadan was positively associated with accessing masjid content online. So good job, Unity Center. Exercising regularly, reading more Quran than last year, enjoying one's Tarawih prayers, giving charity, and mindfulness. And if we can go back and talk a little bit about women, I know that women in particular, the sisters of the community, I know many of my friends and people that I know had a wonderful Ramadan, because women that don't necessarily have access and can't go to Tarawih, can't be at the masjid all Ramadan, were able to access a lot of those programs. Okay, so I'm going to move along, just finish up here with what we can do, just kind of some takeaway points. And these are things that, I know we've talked about in other lectures. I know that we've talked about in the past, but just want to reiterate a few things here. So lean into your circle. We talked about this, when we're going through more stress, we need to use our social supports even more. The schedule is very important. Even if our kids are doing one thing, it's remote learning. When I talk to kids, I try to find out what their learning is like. Some kids are doing asynchronous, they're doing all online, which means they have no online live classes. And unfortunately, especially for teenagers, they can easily slip into the schedule where they're staying up late at night and they're not getting up until the afternoon. And I know it's a good thing parents don't want to get into a power struggle, but this is something that we really do have to reiterate. And for all of us, really be on a good schedule. And that was kind of the nice thing about starting the fall, was that routine again. Routine is really important. And even when kids give you pushback, it's something that we all need. I know myself, if I let myself, if I have a chance to sleep in, I don't feel good. It's like, and on our, that's kind of the beauty and the wisdom of our 5 prayers. Like, really try to go to sleep after Isha, and if you can, stay up after Fajr, or at least don't sleep in too much after Fajr. Focus on whatever self-care means to you. We talk a lot about self-care these days. That doesn't necessarily mean, manicures and pedicures. In fact, actually, it's probably not a safe thing to do right now. But whatever that means to you, and that might mean, especially as parents, we talk about what we can do for our kids, for their mental health. The first thing is taking care of yourself. And if that means that we all need time to ourselves. We all need to focus on ourselves. Sometimes we need, it's really important. And that could be in the form of disconnecting. So if you notice that watching the news all day, or, you have to really kind of disconnect to connect to your feelings. If you're stressed out, if you're feeling anxious, if you're not feeling good, then you need to kind of look at what you're taking in. If it's a lot of news and, negative things, that you're watching or listening to, then you have to limit it. I have a patient that she's been very anxious, very, very anxious. She lives by herself already. She's isolated. She doesn't have any family. She's barely left her house. She hasn't been able to go back to work. She's barely left her house at all since March. And she's watching the news all day. It's actually kind of funny, because I was like, listen, how about we try to do this? Let's try to limit your news to 1 hour a day. I said, things aren't really going to change that much. 1 hour a day is fine. You don't need to be listening to it every minute, hour by hour, things are not going to change. And then it was like those 2 weeks where everything was happening, where Trump got COVID, where the debate happened, like literally every 5 minutes, there was something different on the news. And I was laughing at myself because I was too glued to the news those 2 weeks. And I told her that the next time I saw her, she laughed at me. And we could laugh about it together, which we'll talk about. Focus on what you can control. This is really, really important. Right now, there's so much that's out of our control. But there is still things that is under our control. So focus on that instead of focusing on what we don't know, the unknowns, what we're going to be doing in 6 months, just take it, day at a time, a week at a time, and focus on what you can control. And breathing and mindfulness, this is really important. I know it sounds kind of, like as my son would say, kind of cringy, but it's actually so important. Why? Because when we are stressed out and when we're anxious, then our all the stress hormones are kind of circulating, and we're breathing fast. Our heart is beating faster. Breathing, what it does is actually, it kind of is tricking your mind. It's tricking your body and your mind into slowing down. Your body will follow when you are taking deep breaths. And there's many apps and different ways that you can do this, different techniques. I think Lubna is going to be talking about this. Dr. Lubna Al-Khayat will be talking about this in January, but it's really huge. And there's some great apps to do this too. One of them is called Insight Timer. It's all about meditation, mindfulness, and deep breathing. And this is something that you can teach your kids and teenagers too. Focusing on gratitude. Research shows that when we focus on what we are, the things that to be grateful for, when we, even when they did studies where they had people write down, like 3 or 5 things that they're grateful for every night, and compared to other people that were just journaling, the people that wrote down what they were grateful for, they had higher level, like they basically scored higher on their wellness and happiness kind of scales, even like weeks afterwards. And this is so deeply part of our tradition and our faith, the idea of shukr. And I mean, when we do our tasbih after salah, like being mindful in that too, not just kind of saying it on our fingers, but thinking about something that you're thankful for every time you say subhanallah, alhamdulillah, and Allahu Akbar. Nature.
Assalamualaikum. Yeah, I mean, you can pause, just take a few minutes, because I just want to let you know there's a few questions from the audience.
Okay.
So once you wrap up, and we'll just take a couple of questions, inshallah.
Okay, thank you. I'll try to wrap up then. Nature, movement is so important. Trust me, I am like the most unmotivated. I can be very lazy, but I know that the winter is coming, and I made a commitment to try to get outside, especially my job, as with many people that are working from home, is very sedentary. So it's really, really important to move your body in whatever way that you can, whether it's taking a walk, whether it's running, whether it's any type of exercise. It's really, really important. And even when you don't feel like it, and there's this concept in therapy and that we call behavioral activation. Sometimes, I have a lot of patients that motivation is a huge thing, right? With depression, low motivation is a huge thing. And sometimes people are waiting to feel more motivated they're waiting to feel better, and then they'll go and do things. Behavioral activation is no, let's take baby steps and let's do something. And that is going to help you feel better. Just the act of moving will help you feel better. And it's really huge. And the more you do it, the better you feel. And you really crave that too. And that kind of goes along with nature. I don't know if about you guys, and I don't know if this is the first fall that I feel like I'm not running around like a chicken with my head cut off. Usually in the fall, I'm sure with many of you, it's back to school. I've got 4 kids, and 3 of them, the last few years, 3 of them have been involved with soccer in the fall, and it is so busy. It's like 2 practices, or like basically 3 practices or games every week for each child. And literally we're just running around. And alhamdulillah, because we didn't have that this fall, I didn't do sports for 2 of the 3 kids that do it. We have had more time, and I don't know if it's just me, but this fall has just been amazing. And I think it's just because we didn't really take the time to smell the roses, to notice, to appreciate the creation and the nature around us. Service. So, of course, self-care, all these things are important, but helping other people is huge for our mental health. Helping other people, yes, you're helping somebody else, but in that you are really helping yourself. And of course, with COVID, there's a lot of restrictions. There's things that we can't do. But number one, there's always something that you can do to help somebody else. Many of our kids have community service hours, but more than that, more than the obligation of having to do it for school, I think it's a really important thing to do with our kids. And it's an example for our kids too, to like kind of set up a lifetime of a habit of trying to keep it a regular part of your life to, to help others out. And reaching out, we talked about this idea of leaning into our circle and not being, having the physical distance maybe, but not the social distance. But you know what? Also kind of look out for the people that might not have family here, that might not have extended family here, that live alone, people that are single, that maybe are not part of a group. I know a lot of people have their pods, and a lot of people have their bubbles that they're really comfortable with socializing with outside and in a safe way, of course. But there are, really think about the people that might not have that might not be part of a clique or a group or the community, and really reach out and make sure, because it's really easy right now for people to kind of fall through the cracks, and in that isolation and being alone, it's really magnified right now. So make sure that, we're reaching out, and that goes along with helping somebody and even just picking up the phone. These days we're so into texting that even, have you noticed when somebody calls you, it's like, oh, wow, they took the time to call me. Like that itself kind of, can make somebody feel good. And then of course, if you feel like it's getting too much, then if it's too much for you to handle, then, definitely don't be afraid to get professional help. Few other things. I'm just going to say this one, giving yourself things to look forward to. So, there are studies that show that just planning things for the future, like planning a vacation, for example, actually can increase your happiness even more than the vacation itself is looking forward to it. Obviously, we can't go to Turkey and Paris and, all these amazing places that we had, if we were privileged enough to plan those vacations before, we can't do that right now. But there's always things that you can look forward to. I kind of like this kind of this image. So, there's like nothing else that this person is kind of dreaming about, but you can make small things exciting. And that's a really good exercise to do with your kids too. So that we're kind of teaching them to really appreciate the smaller things. I'm not going to lie. It could be a TV show. There's a lot of shows that are coming out, and if there's a show that you like to watch with your family, I know there's a premiere that I am looking forward to on Tuesday for an unnamed show I won't mention. But it's kind of those little things. It really does help to have little things to look forward to. It breaks up the monotony, and there is always something that you can. And I would also say, even if you're not planning a vacation, something that we have to guard against is overworking ourselves too. A lot of people they continue to work. They're not taking vacation because we can't go anywhere, so I might as well work. And then we are burning ourselves out at work too. So even if you can't go anywhere, first of all, there's a lot of places that you can drive to. But even if I understand that it might not seem safe, especially with the second surge and everything. But do take time off from work. Have some time where you have some unscheduled time too. That's really important. This is some things that we can do for kids, students. I'm going to skip over this. This just slide kind of talks about how family members, how being with family and friends can really help. Of course, it's in a different kind of modality. It might be kind of more online and virtually, but just having that support is really important. This was actually a slide that's just looking at physicians and their wellness. I love this article from the New York Times, and it just kind of shows how important physical touch is, and which is something that many of us are missing and craving. How to Hug During a Pandemic was the title of this. And I just thought it was so telling that, especially with grandparents and grandchildren, right? We want to keep the grandparents safe, but this just kind of spoke volumes to me, these graphics that, this is something that's almost essential. Let's find a safe way to have some physical contact, because we're human beings, like I said before. And it was kind of interesting in this article from the New York Times that says choose hugs wisely. So you don't need to go hug keep it halal. You don't have to hug every acquaintance, but this is for the people that really do. And it's, again, with our older adults that might, our seniors that live alone, they still, we definitely need to pay attention to their social and emotional needs. Some things with kids, maybe I'll talk about this in the question and answer. I think these are things that we've talked about in other lectures. These are just some pictures that I took on a walk, and just, again, the beauty of nature and just appreciating those little things. If anybody went outside today, I know my friend encouraged me to go out for a walk before it started raining, and I'm so glad that I did. And it just seemed the day was even more beautiful, because these things, if you pay attention to it, then it's even more beautiful. And these are just some tips on avoiding burnout working from home. So it's very hard with the boundaries, where work-home boundaries are so blurred, but you have to turn it off at some point. The work is never ending. There's sometimes where you just have to stop and say, okay. And it's really important maybe having a different space for where you're working and where you are relaxing. So maybe not a good idea to work from your room. Turning off email and work notifications. Making sure you're engaging in personal activities so that you really are disconnected from work when work time is over. Ask for flexible scheduling and focus on work during work hours. This, at the same time, when it's time to work, then don't be on your phone scrolling and then you're not productive, getting the things done that you need to get done. And that way, at the end of the day, you can leave. There's always something to be done. I always have phone calls to return. And at some point at the end of the day, I'm like, okay, I have to do this tomorrow. I have to stop now. Okay. And lastly, I'm going to end with this. Laughter may be effective medicine for these trying times. Laughter releases nitrous oxide, which relaxes blood vessels and reduces blood pressure. There was a study in Japan of older men and women that tend to laugh, and it was found that they actually had lower cardiovascular risk. A healthy sense of humor was associated with a longer life in a study in Norway. That also could be because it's a Scandinavian country, and for some reason they're all happy there. And it's not just like a little laugh or it's like a real laugh. A one big belly laugh is what this article said. And again, laughter and humor can reduce stress hormones and increase endorphins, and is actually found to improve short-term memory. This is a quote: "In order to truly laugh, you need to be able to take your pain and play with it." And this is actually from this article. This was a picture. This was a laughter first aid box. This was actually in an office, in a therapy office, and it was just little things to kind of make you laugh. And again, self-compassion. We don't talk to our friends sometimes in the negative ways that we talk to ourselves. Always talk to yourself like you would talk to your friend. And I've shown this in other lectures, basically kind of like which zone are you in when we're talking about COVID-19? There's this fear zone, getting upset easily, just kind of more of reactive, very reactive, and then learning, where we're trying to identify our feelings and emotions, what are our trigger points, becoming aware of situations and thinking before we act, and then a growth zone. This is a neat. Yeah. Lastly, this is an app called the COVID Coach, and you can download this, and it's really helps with meditation, kind of like a mood check, finding resources, managing stress, and learning. These are some other resources, and that's it for now. Let me see. Let me stop sharing then. Okay.
All right. Thank you so much, Saba. I think you shared with us a wealth of information. That was a lot, really great, because I know you kind of like covered all the different age groups, genders, demographics. So I think that was great. Alhamdulillah, inshallah, the tips that you shared with us. A couple of questions. So if you can just so I don't want to leave those untalked. So there's one question that says how can we prepare for staying safe during the upcoming holiday time? For example, Thanksgiving. It's a large gathering. How do you say no? How do you control that? So,
well, I definitely think it's gonna, everybody has their own comfort level already, and people are kind of doing things differently between families. But we do, now that the second wave is, we know that the numbers are going up. I do kind of have to remain vigilant. I don't think, this is kind of a personal opinion, I don't think that things are going to be as drastic as they were with the initial lockdown. I think people are kind of already preparing. They're kind of have maybe a smaller, like I said, those pods or kind of their bubbles, still being safe. Because, even my son wants to play basketball with a few kids, and he's like, it's only 6 kids. I'm like, yeah, but they're playing, they're seeing other kids too. Trying to explain that to a teenager. So it's going to look different. I mean, obviously, I don't think, I know many people in our community have like large gatherings for Thanksgiving, and you have to make a decision for your family, but just realize, we're going into the fall, we're going into the seventh month of this, and we kind of all know the psychology of being together during this time. Like when we're together, it's a little bit more easy to be lax about wearing a mask, about getting close to each other, even 6 feet. I mean, even the 6 feet is kind of arbitrary, to be honest. And if you're inside, and a lot of people are actually postulating that it's the heating system. Does the virus kind of spread more with that? It's just easy when you're in a group to kind of like get more complacent. And so you kind of have to know yourself and know that. And I think kind of plan accordingly. I can't say exactly how every family can do this, but I think it is going to have to look different. I know that I'm not going to, I usually have my parents come up here or we go to North Carolina, but for that short period of time, we're not going to be able to do that. But that doesn't mean that you can't start, maybe do something different, just like how Eid looked different for us, just like how Eid al-Fitr and Eid al-Adha look different. It's like maybe trying a different tradition, doing something different, getting the kids involved. It doesn't have to be, you can still make it fun. It's not going to look the same. Like nothing has looked the same this year, but it doesn't mean that it can't be fun. It can't be special in its own way.
Yep, I think that's true. Okay, there's one more question. I think you kind of touched upon the exercise and workout. I'll just read that question.
Okay.
So, how do I motivate myself to work out after months of being locked inside home and getting out of shape?
Okay, that's kind of a good question because it's something I've been thinking and trying to do myself. It's hard, especially if you're used to, going to a gym or going to other places. You know what? I will say that we're really lucky and we're really fortunate that we just have so many resources at our fingertips. You still can be connected with your friends, actually working out, even if you're not working out together. If you have like challenges that you want to do with your friends, sometimes these like the Apple Watch or like a Fitbit, and you can connect with people and actually do challenges with them. And I don't know, there's something about that competition that brings out the competitive nature in all of us. I have a few friends that I'm following on, maybe they're listening on my Apple Watch, and it's actually really amazing how motivating that can be because I'll see that they worked out and that they have burned more calories than me. And I'm like, okay, I've got like 20 minutes to get something and maybe I can beat them.
I can join you guys.
It's really amazing. It really works. And trust me, like I said, I can be very lazy and I definitely went through that for a period of time during the pandemic. And that can happen, right? When you're feeling burnt out, when you're feeling down, when you're feeling depressed, it's hard to and these are kind of some warning signs. It can be hard to get out of bed. It can feel like you feel very heavy. You feel like it's hard to move. And I definitely empathize with that. And I hear this so much day in and day out from people. Like I said, sometimes, honestly, there's no magic pill for motivation. Even when people are taking medication for depression, motivation does not always come. Sometimes you have to do the behavior and then the motivation comes after. You have to focus on how you're going to feel afterwards. I'll tell you, actually, I'll finish off with this. My neighbors are in their late 70s, early 80s. And he's, I think, 80 years old, my neighbor. And he walks, his goal every day is 20,000 steps.
Wow.
And they are walking and he runs still a little bit, like more than 5 times a day. I know that they're out of town when I don't see them like in one day. I'm like, oh, they must be out of town. When I'm working from home and even not even working from home, even like, therapists, mental health professionals, our job is very sedentary. We're sitting down. Even those days I was only able to get maybe 5,000 steps. And now, and knowing that, so you kind of know where you're starting from. But then I noticed that I was getting unhealthy too. And I know a lot of people that I know were kind of noticing that. And you just, you know what, don't get too down on yourself and just start from today. Just take baby steps and just do a little bit more every day. You don't have to jump to like running a marathon from, what do they call it? Couch to 5K or whatever. just take baby steps, and you will actually, the motivation will come afterwards. And honestly, that it's so good for your mental health too. Movement, it helps your focus and your concentration. It even helps with kids. There's a whole area of research on ADHD in the brain and the effect of exercise and the brain and attention and focus. And it's really important for our kids too. Trying to do things together. And there's lots of things we can do. There's workouts on YouTube. And if you're having a hard time, then maybe reach out to a friend that is a little bit more, just get some advice from somebody else too. And like I said, maybe have a buddy that you can do things with, and that really does help a lot.
Cool. Yep. No, I totally agree on that. So, all right. So I guess we can close now. I hope everybody really benefited from Dr. Saba's the talk, her advice, and some of the statistics and research she brought in light to all of us. So I kind of really like how you kind of brought gave us all the stats. I think that was helpful kind of to see. So, all right, great. So thank you so much, Saba, for enlightening us and helping us talking through. And I know that I will, bring you back again. You're not too far. So looks like, people, have, enjoyed this talk. And inshallah, really looking forward to doing this. Actually, I'm in Unity Center today, but having everybody here, it will be always, a treat. Now I realize how important it is to have actually people join us in person and our speakers as well. But, nonetheless, alhamdulillah, we are still able to do this. So thank you so much. And thank you to all our viewers. Thank you for tuning in. And those of you who are able to watch this recording later on, thank you for watching the recording too. And everyone, stay safe. You're still, there, but inshallah, we are all in this together. And hopefully, inshallah, we will be kind of talking about COVID in the past tense soon. So, all right. So, inshallah, everyone, take care. Assalamu alaikum. Salam Sabah.
Assalamu alaikum. Thank you, everybody. Jazakallah khair.
Jazakallah. Assalamu alaikum.